Law. This is quick internal medicine, and today we're going to talk about how to differentiate whether it's a cardiac dyspnea or pulmonary dyspnea. Okay, so this is really very important because the treatment differs, that's why. Okay, so cardiac dyspnea and the pulmonary dyspnea. In the cardiac dyspnea, there's no history of pulmonary disease. Of course, there should not be any history of what you call pulmonary disease. No history of pulmonary disease. Okay, but the patient can have history of smoking. Remember, there could be a history of smoking because smoking is also injurious to the what you call heart, right? So whereas in a pulmonary, there is a history of COPD. That's a chronic obstructive pulmonary lung disease or a pulmonary disease, right? And a smoking history, of course, it can be here, right? And the onset, if you talk about the onset of dyspnea in a cardiac disease, is going to be more sudden. Whereas in a pulmonary, dyspnea tends to be more occur gradually. So that's why you have to ask very good history in which you will get an idea whether it's a pulmonary dyspnea or the cardiac dyspnea. Okay, and a dyspnea usually not associated with the sputum production in case of cardiac. Sputum, no, right? Here you see what you call a production of the sputum, right? And dyspnea at the night often associated with sputum production and relieved by coughing up the sputum. So this is dyspnea of pulmonary, okay, cause, right? And in cardiac dyspnea, there's no evidence of lung disease on X-ray. If you take an X-ray, you don't see any abnormalities on the chest X-ray, and okay, but you see maybe the evidence of cardiomegaly. Okay, whereas in the pulmonary dyspnea, you see evidence of lung diseases, like signs of what you call chronic obstructive lung disease, right? So these are the important what you call points that will help you to differentiate whether it's a cardiac or a pulmonary dyspnea. Okay, guys. So thank you so much for watching this video. Take care.